in the UK, with the NHS, we have, in many ways compared to other healthcare systems, we have a relatively uniform and centralized system. So that has a particular shape to software, but within that structure and within that framework, it's still got huge variety. Compared to other countries, it's actually something that the UK is relatively well regarded. And I guess, obviously some of the difficulties stem from the same fact that in many ways it's centralized and controlled. It's got both things, but it's certainly different from other healthcare systems and software in other healthcare systems.
It's down, the level of digitization is depends on the resources of the trust. The NHS, of course, has its own NHS digital solutions, which are very much big picture, and data needs to feed into requirements of the NHS. So our relationship is overwhelming with the NHS Trust, and this for the individual school health teams and their management to interact with IT. And very importantly, IT has many demands on its time and resources. So sometimes what can be delivered quickly in one trust may take more time in another trust simply because they may have so much on their plate. Or there are specific electronic patient records systems that they use at the community level, and there are a number of solutions, and how data flows from School Screener, which you can flow very easily into another electronic database. But the setup of that database will be different according to whichever provider of those databases a trust has bought. So there is work sometimes to be done there. But we try and keep it as simple as possible. So from the data side of things, if a trust can export a CSV file for the data, that's fine. But we also have electronic transfers into the electronic patient records. But that varies, as I said, according to how a trust is set up and which particular electronic patient record they're using. We provide the solution for the NHS Trust. There's automated anonymised reporting to the NHS Trust in terms of the global ways the service is being delivered. So that is set up according to their requirements. But from a clinical perspective, they can see the information down to a referred child. So that they have that clinical leadership in place and they can have all the data they require. But we ourselves are not the owners of the data. Very importantly, the data is always the client's data, and we provide the tools for them to help manage their services.
The pandemic was such a great source of pressure, but that pressure was propelling school nurses, public health, and all other areas actually of healthcare towards digitalization. Things that were already in progress but at relatively small speed now became imperative. So things had to be implemented over a very short period of time. New ways of working found. So it's definitely a catalyst.